Join Stella Academy, Goa's best coaching for IIT, JEE and medical exam preparation. Register today for Stellar Talent Search exam. Admissions are open for repeaters medical batch for NEET 2021.
We need to see that every hospital bed cannot be just a bed, but it has to be an oxygenated bed so that people get the type of facility in the periphery. Ultimately, we as ministers and this government, headed by the Chief Minister, is here to serve the people of the state of Goa. We have a Prime Minister who also has, nobody actually talks about the good things that happen.
The health workers that have been at the front line of this entire pandemic, just like the police officers, it is also the nursing staff, it is also the doctors, it is also each and every one of you that have been working 24 hours the last 365 days of the year while everybody was enjoying the lockdown.
लोकांचे आणि माणुसकीच्या दृष्टिकोनात हांव आरोग्य मंत्री असल्या कारणान मुख्यमंत्री गोंय राज्याच्या त्यांच्या सहकार्यान आमी जे कितें करता आमी लोकांच्या हितान काम करता. माझे मिनिस्ट्री जे हा हेल्थ मिनिस्ट्री केंद्र सरकारान नरेंद्र मोदी जे हा त्यांनी 100% वॅक्सिनेशनाचे जे उल्लेख केला ते थर्ड वेवचे जे आमी उल्लेख करता तेका जर आमकां टक्कर दिवंक जाय म्हणून हांव प्रत्येक पेजीचे फेलिसिटेट करपाक आमचो लोक बरोपैकी काम करता.
Over the 1.5 years, many of you have fallen sick. तुमकांय कोविड जालें, म्हाकाय कोविड जालें, जायत्या डॉक्टरांक कोविड जालें, even in the hospital. You all have done a lot of sacrifices.
So आमचे सगळ्यांचे मन प्रसन्न जावचे, आमकां बरें दिसचें, कोण तरी आमची कदर करता अशें दिसचें. The whole program is because of that.
मंत्र्याला तुमचे उपकार मानपाक हांवूय मानता आमचे पणजे लोकांचे वतीन, गोंयच्या लोकांचे वतीन की तुमी जें काम केलें आमी हें केन्ना काम विसरूंक शकना. सरकार जावं कोणूय जावं तुम्ही जे काम केले आसा बरें केलें आसा.
तुमच्या सगळ्यांची फॅमिली बरें उरची, गोंयची जनतेक तुम्ही जे सेवा केल्यात आमी सगळे हात जोडून तुमचे आभार व्यक्त करता.
The Rotary Club of Mapusa, along with the Remote Solutions, we have Rajiv and Jyoti here, who have donated these monitors as well as infusers. What I liked the most was when Abhijit called me and told me that they want to donate some medical equipment. I know that everybody has been giving oxygenators, but what I appreciate about you all that you all checked with the doctors what was the requirement that was needed here, and based on that you all have provided the equipment rather than just bringing something and giving it here where it is unused.